Welcome back to the Pelvic Health Summit. I'm your host, Hannah Matlock, and this is our co-host, Dr. Allison Triconde of Pelvic Rehabilitation Medicine. Today we are here with Carli Blau, a licensed psychotherapist here in New York City who specializes in sex and relationship therapy. Thank you for being here, Carli.
Thank you so much for having me. Thanks so much for having me. I'm so excited to be here. This is such a privilege and an honor, and I'm really excited to provide some information that can be really helpful.
So as a psychotherapist, what is the connection between pelvic pain and sex, and how does that connect to relationship therapy?
Absolutely. So often I think that people think that physical issues such as pelvic floor dysfunction, pelvic pain, or any kind of medical feeling discomfort is not really connected to mental health in the way that somebody thinks and feels. And so where the two of them combined and where it's very integrative is where sex therapy, when someone's experiencing pelvic floor dysfunction of any kind, pelvic pain, vaginal pain, there's often a correlation between that pain and discomfort and how it influences their sex life and intimacy. And that's where I come in.
Great.
So really giving somebody an ability and a safe space to talk about their pelvic floor pain and how it's also how it impedes on their ability to have a healthy and functioning sex life and intimacy with their partners.
Great. And as a psychotherapist, how would you describe your approach to pelvic pain patients?
Sure. So I'm very narrative. My approach is very based in narrative therapy and also psychoanalytic therapy, looking at where behaviors started, how did they begin. There's truth to pelvic floor dysfunction being a medical condition, right? We know that. But also, we tend to get into a cycle. And it becomes a story where we've been experiencing this pain, and sometimes the pain becomes a part of us. It becomes a part of our story. And in order to break that cycle and to stop that story from continuing, it's like every story needs to have an ending sometimes. And in order to start a new story, you've got to end the first one. And so a lot of what I do is giving somebody the power and encouragement to end the story of pelvic pain in their narrative and to rebuild a new story for themselves in which they can look at their body with pleasure and intimacy in a way that they don't experience pain.
Great.
So can you tell us a little bit about what lands people into your office?
Absolutely. So I would say that for the most part, people come in when, in regards to pelvic health, that when people are experiencing pelvic pain and discomfort, it has implications on their sex life and their intimate relationships with partners. And it can feel really lonely to be feeling pain in many ways, especially when it comes to your pelvic pain. So when somebody's experiencing pelvic pain, pelvic floor dysfunction, any kind of discomfort, I would say below the belly button, we're kind of raised in a society where we don't really know how to talk about that. We're not really given the vocabulary or the ability or the know-how of how to discuss that. And that's where you come in, right? And pelvic floor specialists come in to give people the information about it. But then I think what lands people in my office is, okay, now I know what my diagnosis is. I know what I'm experiencing. There's a reason I'm experiencing this pain and discomfort. Now, how do I process that and how do I deal with it, right? It's making me feel all these different feelings, and then I give you a safe space to be able to explore that.
And what effect have you seen pelvic pain have on intimacy within relationships?
Sure. Oh, wow, that's a loaded question. I would say that predominantly, I think the effect that it has is that the main cycle, right, that I think would resonate with a lot of people is that if something hurts you, and what hurts you is what you would use to engage in sex, you don't want to use it. Why would you, right? Like if your hand hurts you, you don't want to use your hand because your hand hurts. If your pelvic floor hurts you, you don't want to use your pelvic floor. So I think there's a connection there, and people come in because they're in so much pain and discomfort, and it stops them from wanting to be intimate with their partners. Now, here's the thing. My husband's a chef. And when we got married, my dad said, these two people got together and they had the best of the two things in life you need to survive, sex and food. When somebody is not able to engage in sex, which is a fundamental aspect of life in many ways, I mean, we wouldn't be sitting here having this conversation if sex didn't occur at some point in the world. So if you can't engage in that, people begin to feel like they're failing at a fundamental aspect of life. And so when your pelvic floor is not working correctly and it's giving you pain and discomfort, it really stops you from being able to feel like you're able to engage in something that's so fundamental. So I think that that's a really key piece as to how it impacts intimacy and relationships.
How can people reframe their mindset, kind of change their story as you're talking about?
It's the coolest thing ever. I mean, I love what I do because I love watching people. The way that I would suggest that somebody reframe it, now this is something I want to stress, is that therapy is a process. It is not, and so is pelvic floor therapy. It is not like you go in, and I'm sure you've seen this, where someone expects, they're experiencing pain, they go in for 1 to 2 sessions and they expect for it to be healed. And they're like, why am I not feeling better? And it's like, hold on a second. If you want to learn how to play the piano, you don't just put your hands on the piano and you learn how to play beautifully right then and there. You've got to practice. It's got to take time. You've got to be committed to the process. You've got to be committed to healing yourself. So the way that I help people change their mindset in this being a process, right, is giving somebody the power to, like we said, reframe their narrative, and also understanding and giving them the empowerment to explore what it would look like for them to not experience pelvic pain, right? Like, what does that life even look like? And for a lot of people, unfortunately, that's not something that I think anyone has ever thought of or even considered, because it becomes so debilitating. So when you change someone's mindset, it's really, you want to find a therapist who's going to challenge you and who's going to challenge the mindset that you currently have to help you build a new mindset so that you're not constantly talking about what hurts you, what's bothering you, and what is pain, but also talking about where you can find pleasure, right? So like, I like to redefine sex as a part of my practice, and that's redefining and changing the mindset. So if somebody's sex used to be certain positions, certain ways of having sex, okay, maybe that story and that way of having sex used to be what you engaged in. But now that you're having pelvic floor pain, right, maybe that's not the way that you can engage anymore, but that doesn't mean that you can't have sex or any kind of sexual pleasure at all. So then we go back to the drawing board and we rebuild the mindset. And I think it's just so empowering to see someone do that.
It's wonderful.
Thanks.
And can you explain the connection between sexual dysfunction and mental health?
Yes. So there is a major connection between sexual dysfunction and mental health. And the reason why, and like I said before, pelvic pain, sexual dysfunction, sex is a fundamental aspect of our functioning, right? Like, we are human beings. Sex is a normal part of being a human being. It's a form of pleasure. And when we cannot receive pleasure from something that is supposed to be pleasurable, I mean, sex is literally, it's to reproduce in one way, if that's what you want to use it for, and also as a method of getting pleasure and feeling really good, and feeling connected to someone else. So if your pelvic floor dysfunction, sexual dysfunction, pain is keeping you from being able to be intimate and to have sex, it's going to have major implications on the way you feel. It can lead to anxiety, it can lead to depression, it can lead to feelings of self-doubt, lack of self-worth, low confidence, and then you throw that into the mix, right? And it can make somebody feel like they're not going to be able to have intimate relationships or a healthy sex life.
You've already been explaining so well the importance of sex therapy for someone who has pelvic floor pain, but can you talk a little bit more about why taking this mind approach and healing the mind and working on the mind is just as important as healing the body?
That's an amazing question. Sure. I think that, so the way the brain works, and I find this super fascinating, is that we have synapses in our brain, right, where it sends messages and it receives messages. And what happens with pelvic pain, sexual dysfunction is when the vagina feels pain, what it does is it essentially, we go into survival mode, protection mode. It sends a message to the brain where it's like, hey, that hurt, don't do it. Kind of like when there's a hot stove, you know how you teach a little kid, don't touch the stove. Essentially, the child's gonna really learn when they touch the stove and they're like, ouch, that really hurt. Now the brain knows, don't touch the stove again. The reason why it's so important to reframe the mindset and to really give your body and mind space to do so is because your body may have been experiencing so much pain during sex for so long that now the constant message that's being sent from your pelvic floor to your brain is stop having sex, you don't want sex. You're not gonna get lubricated, your vagina is gonna be super tight and the muscles are gonna contract, the pelvic floor is gonna contract, everything's gonna be super tight, and that doesn't really allow for sex to be really comfortable or pleasurable or for pleasure to exist at all. And it also stops the brain from wanting any pleasure because the brain decides that, okay, wait, the messages that I've been getting for so long are that when I engage in this thing that's supposed to be pleasurable, I have pain. So I'm not going to engage in that anymore because I'm going to protect myself. And then I see a lot of people come in and they say, I haven't had sex in a year and a half. My partner and I can't have sex. And there's another cycle and a layer to this, which is once you start working on reframing the mindset, then it's like, why aren't we having sex again? My pelvic floor is functioning again. I'm not in so much pain again. Why isn't it back to normal? And then sex therapy becomes so important because it's like, all right, wait a second. You've been rejecting your partner and your partner's been feeling rejected for so long that we also have to think about how that makes them feel. So this is so, there are so many different layers to this. It's like an onion, there are just so many layers to it, but I think it's really important to talk about this stuff.
And you explained it beautifully.
Thank you.
And without a doubt, sex therapy is a very key aspect in healing pelvic pain of any form. But a question that I have for everyone listening is if they don't have access to sex therapy or any sort of therapy that will help them with their sexual dysfunction and pain, are there any recommendations that you can make to get them on some sort of track?
Absolutely. Get educated, learn, do the research. Don't let people tell you that you're going to be freaked out by Google. Take things with a grain of salt, okay? Like ask questions. There are people like me who are willing to help people like you. And you can't, one thing I've learned in life is the worst that anyone can tell you is no. Ask questions. If somebody doesn't know the answer, they're going to tell you, I don't know the answer, and maybe refer you elsewhere. But you can always ask someone a question. So ask questions. It can't hurt to ask questions. And also, get super educated. Read research. Go online and look at Google Scholar and start looking at, and people say, this is very controversial because some people say, don't look at Google, don't look at Google Scholar, because if you don't know what you're looking at, don't self-diagnose. But I also want to stress that what I'm referring to is if you do not have access to being able to afford healthcare or support, I mean, that's a whole nother issue that we could spend hours and days talking about. But to stick to the topic, I think my main answer would be to get educated, to learn about what's going on with your body, and to give yourself the space to understanding it. I think acceptance is a huge piece of this.
And I think also being able to communicate with your partner, if you have one, about what you're going through, because a lot of women are so ashamed to talk to their partner about the pain that they have, the anxiety that they have, and really finding a way, however you can, to be secure and comfortable and communicate what you're going through will really help a relationship, will help intimacy, will help your partner to understand.
Absolutely. So 2 things on that. One, for all of you listening to this amazing Pelvic Health Summit and you experience pelvic pain, and for whatever reason it keeps you from engaging in sex, grab your partner and bring them in here now. And what I want your partner to hear is that your partner's pain, so your pelvic pain, your sexual dysfunction, your pain with sex, has nothing to do with your partner. I mean, so often couples come in regards to this, and they're like, well, she's always rejecting me. She doesn't want me anymore. It's like, hold on a second. Her pain and discomfort, pelvic floor dysfunction, is not about you. They're two totally different things. And when a couple can come to terms with that, there's so much freedom in that relationship. And that's when there's really room and the ability for each person in the partnership to support each other. Because when people can't support each other, it's when they feel attacked, when they don't feel wanted, when they don't feel needed. When you remove that variable, all of a sudden you've got a team. So I think that that's really important for everyone at home to be listening to.
So do you have any suggestions? I get this question from patients all the time, that they would like to see you and discuss their issues with a sex therapist or psychoanalyst as well, but their partner's resistant. And do you have any suggestions on how they can bring it up to their partner and really engage with their partner as a team?
Sure. So I think first and foremost, sometimes what I do in my practice is I would have somebody come in, if the partner is resistant, have somebody come in and do a little bit of work on themselves and maybe bring the partner on at some point in therapy as a partnership. I think sex therapy has a major stigma. People think that it's like, oh, especially, and I hate to say this, and I might get some backlash for it, but I'm going to call a spade here, that oftentimes men feel that if a female partner wants to go to a sex therapist, that it means that they're not performing, and that it's about them. And the reality is, it may not have anything to do with them at all. It may just have to do with the fact that the female partner in that relationship is feeling pain and discomfort and needs a safe space to discuss it and wants to discuss it with their male partner. There's so many other layers to this. I think it's just really important that one suggestion I would have for a partnership and one person feels like they want to go to a sex therapist and they're afraid that their partner is going to be, I don't want to go to that, there's nothing wrong with us, you're being ridiculous, all these different things that we hear. First and foremost, and most importantly, the thing to tell your partner is, like, I'm going to talk to you like you're my partner, is you say, babe, this is not about you, like, or whatever you call each other, right? Like, this I'm feeling and I'm really uncomfortable, and it would mean a lot to me if you could give me a safe space to just talk to you about how I'm feeling. And I think that maybe finding a sex therapist could help us have a safe space to talk about this, where we don't feel like we're attacking each other, but where we can really talk about this in a way where we can have sex again. Because I want to feel close to you. I don't want to not want to be with you. When a partner hears that, that's life-changing. Because for so long, the partner who's on the rejecting end, who's getting rejected because of pain and who's initiating and it never falls through, we don't talk about how painful that is. And so while pelvic floor dysfunction, sexual dysfunction, pelvic pain is really painful for the person experiencing it, the constant narrative of rejection for the partner who's being rejected is also really painful. And so both partners have to have an understanding and respect for the fact that that hurts. Both of them are in pain. And giving each other a space to be like, hey, I know you're hurting and you want to feel close to me and I want to feel close to you, all of a sudden both people are heard. And then you have space to work from.
And I think also it could be really helpful for if you're a female trying to communicate to your male partner about wanting to go to sex therapy. I think it's so important to explain the fact that you're not just doing this for yourself, but you're doing it for them because you want to have a sex life again. You want to be intimate. You want to bring that connection back and have that connection. And this is something that you're doing for them because you want to make them happier in addition to making yourself happier. I'm not saying come with me to therapy for me. It's for us, to make our life better.
Absolutely, and I think you just hit the nail on the head. I think it's not even that you're doing it. You want to be careful that you're never doing something for someone else. Mm-hmm. There's a really famous quote, and it says, I'll take care of me for you if you take care of you for me. Now, when I was younger, I thought that meant that I'm going to take care of me so that you benefit from it, and you're going to take care of you so that I benefit from it. What I've come to learn in both being a sex and relationship therapist and having this be my specialty and also growing up in the world, I've learned that actually what it means is I'm going to take care of me for me, not for you. I'm going to take care of me and my body for me. And by doing that, you'll benefit because you don't actually have to take care of me. You can take care of you. And by taking care of you, you'll benefit, and I'll benefit from that because I don't have to do that. And it allows me as the partner to focus, and the partner who's experiencing any physical pain, pelvic pain, sexual dysfunction, to really focus on self-healing and to fix the self. So when you're talking to a partner about pelvic floor dysfunction, pain that you're feeling, any kind of sexual pain or whatever, it's really important that you talk about me. And not me, but you talk about it as if it's your pain and your discomfort and not we or you. Because when you use the words you, it's like, this is a big lesson for anything in life that I've learned, and I'll share it, is that when you're talking to somebody and you want someone to understand how you feel, when you use the word you, someone's automatically on the defensive because now they're thinking you're talking about them. If you use the word I feel, I am, I experience, this is happening to me, there's no space in that for somebody to get defensive because it's not about them. And your pelvic pain, your infertility, your experience with pelvic pain, infertility, sexual health, your body has nothing to do with somebody else. It's your body. So when you talk about it, try talking about it as if it's my feelings, my discomfort. I want a space to talk about it for me because I need a safe space to talk about this. You may be my partner, but I really want to share this with you because I'm feeling that I don't have someone to talk to about it. And I need that support. That's very different than, I need you to listen to me. Because you know what your partner's going to say? I am listening to you. I do listen. Instead of, I feel like I'm not heard.
And they can't say no to that.
Because there are two things in life that no one can take away from you, is your feelings and your dignity. And as long as you hold on to those two things, especially your feelings, no one can tell you that's invalid. That's yours.
Thank you.
Yeah.
Beautiful.
Thanks.
And where can everyone contact you or
Sure.
follow you on Instagram?
Sure. So my Instagram is sex.carli, like sex doctor, but sex.carli. And you can go to carliblau.com and find all the information there, and would love to have everybody come in.
Wonderful.
Thanks.
Thank you. Thank you for sharing all of this wonderful information and really explaining the connection between the mind and the body when you are working on healing any sort of chronic pelvic pain.
Absolutely.
Thank you.
Thank you so much for having me. This has been awesome.
Thank you so much for watching. If you can relate to this video, please leave a comment below and share it with anyone else who you think may benefit. Thank you.